Okay, so we can start now. Welcome everyone on behalf of Sing Health Duke-NUS Global Health Institute. I'm delighted to welcome all of you to this webinar series that focuses on the impact of COVID-19 on health and health inequities in the ASEAN region. This webinar is the third installment of our 5-part webinar series. Today's session will provide an overview on the existing nutrition inequities and how they have been negatively impacted by the current health crisis. Our speakers will present on how COVID-19 and the associated economic downturn are impacting food security and nutrition, and some potential measures countries in the region can take to decrease the impact of COVID-19 on undernutrition. I'm pleased to welcome our moderator, Professor Martin W. Bloem, who is the inaugural Robert S. Lawrence Professor and current Director of the Johns Hopkins Center for a Livable Future in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. He joined the center in 2017, relocating to Baltimore from Rome, where he spent 12 years as a senior nutrition advisor at the United Nations World Food Program and as a global coordinator for the Joint United Nations Program on HIV/AIDS. Martin has over 3 decades of experience, primarily focused on challenges of nutrition, food security, and food access, particularly in low and middle income countries. He has also inspired me greatly in my own career, as he is my father, and I look forward to the discussions. Over to you, Martin.
Thank you, Senefa. Well, welcome. Let me start to say that I'm really pleased that that they asked me to chair this interesting session with many different groups joining us to discuss this incredible, important topic of the implications of COVID-19 on nutrition, particularly in the context of Southeast Asia. So we have an hour to go. We have 4 speakers, and let me start with introducing the 4 speakers. The first speaker is Dr. David Dawe. He's the Senior Economist and Strategy and Policy Advisor at the Regional Office for Asia and the Pacific of the Food and Agriculture Organization, FAO, in Thailand. He worked previously for the Harvard Institute for International Development and the International Rice Research Institute, and has spent most of his professional career on food policy in Asia. He has published books and research articles in the areas of trade and markets, domestic price policy, production, and natural resources, and also nutrition. The FAO just came out with their SOFI report this week, so we are quite up to date what the food security, insecurity situation is in the world. The second speaker will be Professor Imon Udamskismale. I know Imon already for a very, very long time. She is currently the senior advisor, but former director of the Institute of Nutrition in Maidon University in Thailand. But she's also part of our university because she's an adjunct associate professor at the Bloomberg School of Public Health. She currently serves on many, many boards, including IFPRI, the Micronutrient Forum, ILSI, but she also has been a very key player not only at the start, but definitely also at the start of the global scaling up nutrition movement. And and that's a movement where many of the other speakers also are part of it. The third speaker will be Dr. Jean-Devon Poksai. Dr. Jean-Devon, she is the Deputy Permanent Secretary Cabinet of the Ministry of Health in Lao PDR. Dr. Poksai holds a PhD as well as a medical degree. The PhD is from the Human Sciences from Osaka University in Japan, but she also has a Master of Health Science on International Health from the University of Tokyo. And her MD is from the Lao Medical University. She also worked on the scaling up nutrition implications in the movement, and was the secretary of the National Nutrition Committee in Lao PDR. The last speaker we have is also a good friend of mine, is Mr. Exton Salem. He also, like Imon, had been involved in the scaling up nutrition movement from the beginning. But he has an awarded Bachelor of Science in Business Administration from the University of Colorado. But since 2009, Mr. Salem has several senior management positions in Indofood. And Indofood is a leading Indonesian food company with operations spanning from the production of raw materials and their processing to consumer products in the market. And you know, it's a global business. It I think export mostly to 80 or 70 to 80 countries in the world. And in his role as part of the scaling up nutrition movement, he was very critical in setting up the business group within the scaling up nutrition movement, which is of course very critical in tackling the problem of nutrition, representing the private sector. So, so let me start to ask Dr. David Dawe with his presentation.
Okay. Yeah, thank you very much, Martin. Good morning to you, and good evening to everyone else, I think. Thank you also to Sing Health and Duke-NUS and the Global Health Institute for inviting FAO to participate in this webinar. First, I'd like to start briefly with a little bit of an overview of where we were at the end of 2019, before COVID. So before 2019, FAO, the report that Martin mentioned that was recently released this week, estimates that there were 688 million people in the world who are undernourished, about 65 million of which are within the ASEAN region. So it's quite a big problem, even before COVID. In Southeast Asia, about 25% of children under the age of 5 are estimated to be stunted. And poor people suffer disproportionately from these kinds of problems, not surprisingly. In fact, children who are born into the bottom 20% of the wealth distribution are more than twice as likely to be stunted as children who are born into the top 20% of the wealth distribution. So we have big food security and nutrition problems even before COVID. Now, COVID hasn't made things any better. Not surprisingly. I hope you can all see up on the screen there the growth projections from the International Monetary Fund, which is now projecting that advanced economies GDP will contract by 8% this year. And even in emerging markets and developing economies, their IMF is projecting now a 3% contraction in 2020. It'll be a little bit better in Asia, where they predict about a 1% contraction. But this is, but even a 1% contraction in Asia is quite a come down from the 5.5% growth that was experienced in 2019. All of this loss of economic output has led to job losses. And these job losses are making it difficult for many poor people to afford food in general and nutritious food in particular. So that's the real bad news. Next slide now. The relatively good news is that food markets and supply chains seem to generally have held up pretty well. So this slide shows data collected by FAO on the prices of food that are traded in international markets. This shows the data up there are shown for the last year and a half, and you can see that the main sources of nutrients and energy, cereals, meat, and dairy, you can see the prices have fluctuated a bit, but not too much. Even 6 months into this year, they've been pretty stable. So all in all, world markets are relatively calm. We can go to the next slide. And that one shows that not only are world market prices stable, but so are domestic food prices have been stable so far. This chart shows the annualized increase in real food prices based on changes in the consumer price index since the very end of last year. And you see food prices have actually fallen relative to general inflation in Bangladesh and China and Sri Lanka, even in the countries like Malaysia, Thailand, and Vietnam, where prices have been, increases are projected to be about 8 to 10% for the year, that's still not that big of an increase. So there have been lots of reports of farmers having to dump produce, vegetables and dairy products and everything. And when those things happen, it's devastating for the farmers involved, but there hasn't been enough of that, I don't think, at a macro level to really impact food prices severely. In fact, even in Thailand, the food prices received by farmers have been going up generally for most foods since the end of last year. That's not what you would expect if they were being forced to dump lots and lots of their food. So overall, I think food supply chains have been holding up pretty well. So that's the good news. But the bad news is the big loss in employment and income for many, many people. Now, this loss of income leads to two main chains of impacts. One is for individuals, especially poor people who lost their job, it's more difficult for them, not surprisingly, to afford food. And it's especially difficult to afford nutritious food. The poorest people, when they suffer these income losses, they'll often retreat into spending their food budget on rice alone because they can't afford meat and eggs and fruits and vegetables. And so this can lead to serious nutritional problems. The other main chain of impact is that the big loss of output overall is cutting into government tax revenues, which makes it difficult, or can make it difficult, for governments to fund health services, things like vaccination programs and vitamin A supplementation that are important over the longer term. So those are the two main chains of impacts. Now, so coping strategies, how do poor people cope with these problems? I mentioned one way already, and that is a change in composition of the diet. People start buying less nutritious food because they can't afford it, and in many cases may start eating more food that is less nutritious. Other coping strategies include drawing down savings, but there won't be much of that for poor people, obviously. Poor people often sell their assets, but this can affect their long-term capacity to earn income. And they can also take children out of school because they can't afford school fees. This also obviously affects the long-term income earning capacity of their children. So there's a variety of coping strategies that poor people use, but none of them, and they're essential. Poor people have no choice, but at the same time, they all have serious consequences and deleterious effects on food security and nutrition. Now, what are just to wind up briefly, what are some of the policies that governments can use to reduce the adverse impacts on food security and nutrition? So the first one is obviously to get control of the virus, make sure it doesn't infect more people, make sure that people working in food processing industries aren't afraid to go to work. The second measure is to expand social protection, to make sure that income gets delivered to more people when they do lose their job. Governments need to work together with the private sector to make sure food supply chains keep functioning. Overall, I think governments did a pretty good job of doing that in this part of the world in Southeast Asia so far. Another important point is to avoid food export restrictions that make it difficult for importing countries to access food on international markets. There were some of those early on, but those have largely ended in Southeast Asia. And finally, there's a need to build resilience into food systems to guard against future health shocks, guard against future economic shocks. I think we need to, instead of having our food systems be set up to deliver food just in time, we need to think more about just in case scenarios. So these food systems need to be more resilient. So I'll stop there. Thank you very much, Martin.
Thank you very much, David, because I think, you know, it's very important information you have given us, because like we have, if I could summarize it, we don't, at the moment, we don't see the implications on the production, but we definitely see an implication at the micro level of, you know, the implications on the consumption. And as you know, we did similar work during the Asia economic crisis, and we found that in a very short period, the implications are that we see an increase of anemia levels among young infants. And, you know, iron is very important for the brain development. And so many of the issues which you know, you presented as consequences for long-term, you know, development in the region. The other issue, which I thought maybe you can you know, reply quickly to my question, is that at the moment we have about 13 million people are infected at global level. We have almost 600,000 people have been, you know, died because of COVID-19. But we are just at the beginning. If you look at most of the zero conversion data from countries like for example, Spain, but New York, is that even after the big crisis in New York, as well as in Spain, you only have currently 5% of the Spanish population have been infected, despite the enormous crisis we had in the healthcare system. So what do you think are the implications, the long-term implications for this on all the issues you just presented?
Okay, yeah, I think, yeah, no, it is a little bit scary when you, you know, look at the low percentages of people that have been infected. I think the more we can slow the process down, the better off we'll be. I think governments need time. I mean, you know, governments partially need time to prepare social protection programs, but you know, to be honest, a lot of governments, especially in the poorer countries, they won't be able to afford very much. They just don't have the money to do it. And it's not unfortunately, it's a situation where even the budgets of developed countries are strained. And so that reduces their potential, I think, for supplying aid. They're much more worried about their own populations. And so that it's potentially very, very challenging. I think, you know, obviously work needs to proceed on a variety of fronts in terms of vaccine development and keeping physical distancing and things like that. But yeah, it could be very, very bad if this continues for very long.
Thank you, David. Okay, let's ask Professor Imon to give her presentation. Imon, please, go ahead.
Thank you very much. Can I have the slide? Thank you. I think I will just carry on from what David had said. In 2019, the status before COVID of the burden in Southeast Asia, particularly malnutrition, show us that it is already multiple burden. And you can see the differences that all the countries in ASEAN, from one end of undernutrition to obesity and non-communicable disease. So many of those burdens actually, when you translate and say, is there any progress? Well, the region is doing pretty good in trying to control the under 5 overweight based on the global nutrition targets, exclusive breastfeeding, under 5 stunting, and diabetes in men. Pretty much carry on progress on course, but no countries are on course for others, under 5 wasting, low birth weight, anemia, and adult obesity. So one of the things that happens is that there's also insufficient data for most countries to do this. Next slide, please. The things that strike me about ASEAN is that if you take a look at the geostatistical graphic, it shows inequalities of malnutrition. Let's put stunting, under 5 stunting as an example. You can see that in the same country, there are different shades, and they are across ASEAN, different severity of scale. So we could have to say, what is it that matters? It does matter to pay more attention subnationally, because the average number of the whole country will mask some of the problems that you need to solve in-house. And these are also speak the same as with other. If you plot wasting, if you plot overweight, it's all say the same thing. So this is where I think the message to come across is that subnational aggregates do matter. Next, please. With that backdrop, COVID-19 came along. This is when what reminds me of is such a classic vicious cycle of a perfect storm. People call COVID-19 that because the consequence, as you have heard from David, economic shocks, is going to lead to poverty. Actually, it's not really number of people who are in the cases or dying as much as the lockdown measures to contain COVID-19 pandemics all over the world. It's going to create a lot of unemployment, poverty, lead to hunger, food insecurity that David has said, and I think that's already been laid. But what does it lead to? It leads to malnutrition in all its form. One side of the coin, you will see poor household already stunting and wasting scenario. So less money to buy good food, even enough staples to hold themselves up is also going to be a problem. So undernutrition on one end. On the other side of the coin, the cheap food that high energy and calorie could also hurt another group. So obesity will also going up. And of course, several of the non-communicable diseases that we know, people who are vulnerable to COVID, obesity, diabetes, and others. In between, we are also seeing micronutrient deficiency. Micronutrient usually are in kind of what you can say bioavailable in animal food source and some of the fruit and vegetables, and they are pricey in many cases. With malnutrition, you get to infection, and it's vulnerable. People are vulnerable to infection. They reduce work capacity because of their illness. It reduce productivity, and here we go back to problem with economy. The things that strike me, that two things at stake. Every percentage point drop in global GDP are likely to add 0.7 million stunted children to the board. Wasting also. Increased wasting account for 18 to 23% of child death. And if you add the disruption of the health system, reduced coverage of antibiotics, and also oral rehydration solution for diarrhea, it will add up to 41% additional child deaths. That has just been published recently. Next, please. With that at stake, what should we do? What to be protect? Well, health is a prerequisite for economic recovery, not another way around. And food and nutrition is a prerequisite for health. If you have good nutrition, it strengthens your immune system. It's like I am ready to fight. This is, if compared to warfare, you need to make the warriors strong. And this is what nutrition do. Essential health service for women, children, elderly should be protected. And I think that there's a lot of cases where vaccine could not get there, vitamin A supplement, antenatal care, those group of supplements. What are we going to talk to them about when these things end and people who are suffering during COVID era? How are you going to look them into the eye and say that, sorry, we can't give you anything of that sort? the other, besides disruption of health system, is the agri-food system that needs to be kept going, particularly the small holder farmers, the micro enterprise that is really the source of food for the poor communities. Now, for social safety nets, that has already been mentioned by David, but one of the things is that the World Bank has just reported that over 170 countries also has already enacted new social protection, particularly cash transfer, in-kind food, and voucher scheme. But this, how long would it last? And we don't know when. So this is all need to be protected. Next, please. It's the last slide I have. It's that with all the things we said, what are the opportunities for ASEAN? ASEAN has, and one of the things is that the COVID-19 has increased such a demand. For the first time, health, nutrition, wellness products are on demand. Healthy foods, vitamin supplement, everyone was going for that. This is where alertness of health in what you eat or consume is at an all-time high. It is an opportunity to bring health system and food system together. This has been separated for so long. And to mainstream nutrition and sustainability consideration, the SOFI report has a very key observation, is that the health cost due to poor quality diet or unhealthy diet will reach $1.3 trillion in 2030. But if you choose to change right now to a healthier alternative, healthier option of food, they show that this can offset that cost, not only for the health cost, but it's also offset the reduction of greenhouse gas. This is one of the things that I think we need to take a look at. Digital platform in ASEAN is another thing. ASEAN community is very digital oriented. This is an opportunity. Innovation in food and health system need them, and their talent should be used. The food producer, this is we are known for, ASEAN food producers, food trade. This is the time to shine. It is the time to be able to take a look at what's good you have. And the food culture with healthy and sustainable diet should be brought up as a backdrop and part of the eco-health tourism that people enjoy ASEAN for. I'm going to stop there, and there'll probably be more opportunities, but this is some of the things I found, is that with the challenge, we also have opportunity. Thank you very much for your attention.
Thank you, Eman. So you really presented something which is, started off not very optimistic, and rightly so, looking at the implications of COVID on communities. I think it's very important what you mentioned is that the implications are very local, and quite often we tackle the problem of malnutrition at global level or at national level, but it's definitely, you have to understand your epidemic. What I thought was very interesting too, that you said this is actually, it is so grim. And so if you really want to do something about it, you have to use this opportunity to change it in a different way. So thank you very much for that optimism at the end of your presentation. Let me give the floor to Dr. Gendefon, for the third presentation. Please go ahead, Doctor.
Good afternoon, good evening. Do you hear me? Yeah. I am delighted to share the Lao experience on impact of COVID-19 on food security and nutrition, because you already listened about the global experience and also regional, but I just would like to share about the country experience. And actually, despite of the 5 years of Lao PDR reduced stunting about 11% from 44% to 33% in 2017. The reduction is attributed to the high level of the political will of mainstreaming of the National Nutrition Action Plan in the national and sectoral plan, in the sectoral plan, and mobilizing resources from external and domestic source, and through effective multi-sector coordination at policy down to operational level, and support the strong community ownership. However, the nutrition status, next please, next slide please. However, nutrition status is still high, and next please. And 1 in 3 children under 5 are stunted. And we have the 18 provinces, 11 out of them very high stunting rate, over 30%. And about nearly 60,000 absolute number of children under 5 suffer from severe acute malnutrition. And we still have remain high micronutrient deficiency and also triple burdened, including high undernutrition, high anemia, and increasing of overnutrition. Next, please. And malnutrition have been exacerbated by COVID-19 outbreak, which is very challenged to reach a stunting rate target 25% by 2025. And when we look at the economy consequence for malnutrition relate, about nearly $200 million annual loss. And within COVID-19 outbreak and associated with lockdown, impact on government revenue loss about 30%. And also the GDP reduced from 6.5% to 3.6%. What we are doing to take a measure? So the government has reducing 10% of governmental budget to its sector, including health. And also governments emphasize on each sector should prioritization of the intervention, and also cut off the administrative costs in every sector. Next, please. And COVID-19 outbreak is in the dry season post-harvest after like 3 months. So therefore, the accessibility and availability of food in both in urban and rural area are observed not very serious problem. However, the affordability is a challenge due to people has less income. And also from now on, it is the rainy seasons. If the flooding occur like last year, it would be big worsened. What the governments take the measures? The firstly, government control the consumable and food price. And also we promote the self-reliance. For instance, urban citizens have changed their behavior to plant vegetable and fruit and consume local food and products, which less before COVID-19 outbreak. And also promote the solidarity and propaganda citizen mindset of helping and supporting each other, like we have done in the last year during the flooding natural disaster. And at the same time, we also have the propagandas for implementing of the government order for COVID outbreak response, like a lockdown, and also a social distancing, and now is a new normal. In addition, we also providing meals and room for retaining migrant workers during 14 days quarantine, and also for patients who admit to the hospital. Next, please. Maternal and child nutrition have been aggravated by COVID-19 outbreak, because they have disruption of routine essential health and nutrition services, including micronutrient supplementation. I very agree with the Professor M.On presentation. And we have broad coverage of especially the first 1,000 days services, including antenatal care and daily, weekly iron folic acid for pregnant women and reproductive women, and also with the vitamin A and deworming supplementation for children under 5 or adult, and also vaccination. And child well-being, the services also disrupt. And in addition, we have limited resources, especially health workforce and budget are constrained because we are focusing on our COVID outbreak, especially at operational level. And people also reluctant to receive the health services at health facility because they are fearing of the contaminating of the COVID disease. Next, please. And also, the challenge about the supply chains, especially for the drug of malnutrition and maternal and child, and due to inflation and increasing of the price, especially for export product and fund constraint. And what government take the measure is that we have boost implementation and services with our limited resources. And also we have prioritization of the program. And we focus on geographical area with low coverage. This means that we cannot do every intervention and cross country. So therefore, those prioritization and focus is with the low coverage geographical area. For instance, we have the providing of integrated MCS and nutrition services in hard to reach area, the so-called zone 2 and zone 3, that means it's far from health center and from health facility. And we also have strong health education provision cross nation. And also we have the promoting of public-private partnership and negotiation with the supplier in order to have their flexibility for the supply chains. Next, please. And as we all know, I think my summary, fighting with COVID-19, just like a battle, it has magnitude of effort and extreme damage. We don't know when it will be finished. So the most important is ending or controlling of the COVID-19 in order to mitigating of the worsened from health to health and food security as well as nutrition. And the second is we turn the crisis of COVID-19 response into our opportunity. How and why? Because this is really opportunity to strengthening or reviewing and resilience of our healthcare system and services. And also using of the mindset of reliance, like a promoting of domestic production, like a food producer, like a domestic or local food producer, and also promoting or consume healthy food, and also resilience of food security and nutrition. My last point is that it is still valid. Invest on nutrition is human capital development, and put nutrition people at the center of fighting disease and poverty. I very agree with our previous speaker. Thank you very much.
Thank you very much, Dr. Gendefon. So what I've heard so far is it is very clear that the COVID-19 will have very much implications on the economics of in the world, and particularly also Southeast Asian. And I think David really explained the really importance of implications at the microeconomic level, particularly at communities, at household level. Dr. Mon presented, in fact, the implications at the local level, that in fact stunting is not something which you can only look at the average. You really have to understand the local implications. So they are different in different places. And I think, Dr. Gendefon, what you really explained very well is that the implications on on the country are quite dramatic, particularly when you think about the whole healthcare system. So I have worked for a long time for the World Food Programme and worked very much in emergencies. But this is like a global emergency. So in a way, it's very difficult for countries, of course, to respond to something which is normally only in a smaller part of a country, or and so it's almost impossible to start to respond at the global emergency level. But what I've heard also so far, it's very key that, in fact, what we can expect from a nutrition perspective is that the first coping mechanism of poor people is actually diminishing the animal source food. And automatically, that's why micronutrient deficiencies will increase. And we all know the implications of micronutrient deficiencies on mortality, vitamin A, zinc. And that's why I think the first step in trying to control the implications of COVID is definitely thinking about the micronutrient deficiencies. So our last speaker is of course like, Exton, and he could, I would like to see how in fact the private sector is responding to the crisis of COVID-19, particularly in the context of Southeast Asia.
Yep. Thank you, Martin. Let's hope we can do this in like 7 to 8 minutes. So thank you once again for the invitation, Sing Health, Duke-NUS, and of course our Global Health Institute. So before anything, I think we are definitely not in a health crisis or in an economic crisis, but we are in an economic crisis because of a health crisis. So amongst the uncertainties, we definitely have no prior experience to any of this. And we don't have a cheat sheet on what to do. And then the trial and error method is being used by all of the different governments that are experiencing it. And most importantly, most of the countries' governments are forced to prioritize and play tug of war, either within the health or the economic. So I'm good to the next slide, please. So if we look at Indonesia, I think pre-COVID, Indonesia is already a country that is plagued with nutrition problems. 30% stunting rate, with 5 million children born every year, you have 1.6 million children every year that is at risk of being stunted. And of course, I think at this point of time, last year we did have a research done, and it's about 6.6 million children who are stunted in Indonesia at this point. And of course, with COVID, there is 40% of the children under 5 that are at risk, and with this, it's going to be difficult to reach our target of 10% in 2020, 10% stunting rate in 2020. And of course, we don't have sufficient data as well as the previous speakers mentioned earlier. So next, please. So I think this is a recurring theme in the previous speakers as well. Rising unemployment due to COVID and social distancing measures have led to the disruption of supply chain and economic activities. And of course, also leading to the decline in purchasing power and increasing the risk of food insecurity and malnutrition. Then the negative effects are most likely to be impacting the poor and vulnerable groups who have less resources to absorb and adapt. And Indonesia, 74 million people are at risk. And as of May 2020, there's 1 million workers who are told to stay home or either receive unpaid or half of the salaries, and over 600,000 formal and informal workers who have been laid off or impacted. Yeah, next, please. Yeah, so Indonesia, I think for the past 10 years, we are very grateful that we've been able to have a stable growth. Our per capita GDP last year is about $3,840, but the minimum wage of our country ranges from $175 to about $280 a month, which about is 49% is going to be spent on food. So if you add another layer of complexity in Indonesia, it's archipelago, there's thousands of islands and regional autonomy as well, which creates accessibility issues on price and affordability as well, issues. So and I think there's a few times that this is being mentioned as well. Global trade plays a part in it. In the beginning of the pandemic, exporting countries such as Vietnam, Thailand, USA, Brazil are prioritizing their domestic needs, and such as rice, wheat, corn. And so with a very quick snapshot in the beginning of the pandemic, commodities increased 5 to 20%. And while commodities such as shallot and sugar in Indonesia increased to about 30%. So the reduction of household income plus reduction of our purchasing power due to the economic impact of pandemic, coupled with supply chain disruption, may push the households to sacrifice the quality and quantity of the food consumption, further increasing the food and nutrition insecurity. Yeah. Next, please. So let's take a brief look at what the health structure of Indonesia is. First, the public system is administered in the line with the decentralized government system in Indonesia, with central, provincial, and district government responsibilities. The Central Ministry of Health is responsible for the strategic direction, setting of standards, regulation, ensuring availability of funding and human resources. Provincial government are responsible for providing the technical oversight and monitoring of the district health services and coordinating the cross-district health issues within the provinces. And the district government are responsible for the district public health network of community health centers, also known as the Puskesmas, and associated sub-district facilities. But if you look at the yellow part, this is one of the most important part of the equation, which is the POSYANDUs. The POSYANDUs, which is the biggest opportunity to reach out to the community villages. So it goes down to the village level. POSYANDU is founded with the collective effort of communities within the village or level to provide basic health services for mothers and children, where the mothers can learn about the basic health information. So, however, this link, if you look at this chart, there's a missing link. The Ministry of Health is only up to the Puskesmas level, which is the sub-district level. So, and to add on to that, POSYANDU is also run by volunteers, and usually these volunteers do not have the background education or support from the Puskesmas, which is the district level, to carry out the activities that is needed. So next slide, please. So I would like to share how business could be part of the solution. So in terms of COVID issues, of course, I think the number one issue is how we can stay afloat to try to keep the workforce. Then second is, besides the food aid, there's also us as producers, can maintain the fortification of staple foods, such as wheat flour, cooking oil, despite the relaxation that the government has implemented or regulated. So, but for a mid and long-term solution, we definitely have to have education. Education is key. As discussed earlier, there's a big opportunity for us to tap into utilizing the arm of the POSYANDU. Yeah, I would like to share with you an ongoing case study on how the government, academia, and private sector can work together. So POSYANDU Mandiri, which translates directly to independent POSYANDUs. In the outskirts of Jakarta, Indofood Bogasari has adopted 54 POSYANDUs, and together with the University of Indonesia Public Health faculty, implemented POSYANDU since 2016. And now we have served over 8,000 children under 5 and 290 pregnant women just from that 54 POSYANDUs. So how does it work? So we started off with training 20 masters, and then the masters would be training 250 POSYANDU volunteers, teaching them POSYANDU operations, nutrition knowledge, such as 1,000 days, anthropometry, balanced nutrition, communication, and of course, motivation as well. But what is important is that we need to create a sustainable model. How can we create an economic impact so that the POSYANDUs can finally be independent and financially independent as well? So Bogasari Baking Centers, which is part of the Bogasari, teaches these volunteers to create breads, snacks, and of course, cakes as well, to be able to sell it to the community, and hence making it independent, financially independent. So we're very happy to be able to see that, we've seen 30% reduction of undernutrition cases in the POSYANDUs since we started. So how can we make this POSYANDU into a gathering place to support mothers and children's health? How can we make it into a space where we can disseminate proper nutrition information? And how can we help so that POSYANDUs can be independently sustainable? Next. So this is my last slide. So food and nutrition security is not a problem that is caused by COVID pandemic. But due to the economic repercussions of COVID pandemic might further the seriousness and create a backward step in a country's attempt to improve it. So in Indonesia, there's a big opportunity for us to tap into a platform that is closest to the village community level and people who are most impacted. Maybe it's time for us to take it seriously and look at using this platform to implement the two proven methods to bring down malnutrition. One is proper education, and the other one is proper intervention. So let's discuss.
Yeah, thank you very much, Exton. For me, it's really interesting, like for the audience, they think maybe we have met before and discussed the several presentations, because what I've heard, of course, are in principles very similar story from all the four speakers from a different angle. And it is very clear that if we really want to respond well to the crisis of COVID-19, and what Exton said was very clear, it's not the COVID-19 itself, it's the response by governments based on the fact that, of course, social isolation and that has consequences for economic consequences. We even haven't discussed the implications on tourism. And we know that Southeast Asia has a lot of tourism, Bali, Thailand, Cambodia, and the implications on the economy are quite dramatic, for example. But each of you have made it very clear that if you really want to do something about this, we have to take it seriously and we have to focus on the communities in many different ways. The POSYANDU is a system of the communities, and Indonesia, Exton, you gave an excellent example how to do it. I think Dr. Jandevoon made it also very clear that if you really want to respond, we have to think about the healthcare system. How can we optimize it in the most difficult circumstances? And I think Imran made it also very clear that if you think about it, it's a link between the health system and the food system. And I think what David also showed very clearly, this is not over. This will continue over the next year, and the implications among the poor are very, very, very large. So if you really want to tackle this, you have to focus on the poor, means automatically, again, the local communities in the POSYANDUs. Let me see, we have about 7 minutes left. I see whether there is another question. So some of the questions are based on the response of governments, and as we all know, the response by many of the high-income countries, if you think about the US and you think about Europe, was based on the fact that the healthcare system was overflown. They had to protect the healthcare system, and that was the reason for the lockdowns. And of course, it's what I think, Exton, you just said very clearly, and also what I think David made very clear, it's a balance between the economy, opening up the economy, and protecting people from a healthcare system which is collapsing. So I'd like to ask you, and if you can actually respond, relatively quickly within a minute or so, each of you, how do you see what the response should be of each of the Asian countries, besides, of course, working at community level from a lockdown perspective? Let me start with David. David, what do you see as the challenge between the economy, opening up the economy and closing down the economy in the context of COVID-19? David.
Okay. Yeah, thank you, Martin. Not an easy question to answer. I mean, about all I can say is I think, people need to governments need to control the virus as best they can. Different countries will have to do it different ways. Poorer countries that maybe don't have, who have more vulnerable people can't afford to shut down the economy as much as a rich country can. We'll just have to do their best with masks and things like that. I think just relying on the best science and of course hoping that a vaccine comes along sometime soon, trying to target social protection as best as possible. But there's no easy answers for a really poor country if things really take hold and get bad. You're squeezed on kind of all sides, so there's no easy answers. Over.
Yeah, excellent. I completely agree, David. Iman, what's your point?
Yeah, it's a challenge, isn't it, about to open or not to open. But I would say that we are learning very, very fast about this lockdown, work from home. When the crisis happens, there are lots of innovation. If you want people to innovate and creative, you push them. There are, at the moment, we are seeing as never been before, several of the systems from community level down back to the IT, telemedicine, telecare, health service that could be done, and you can use just the mobile. It's being used, the apps, and some of the things that we felt we have never thought of. I would say that this is where we need to spend the time promoting, supporting some of this, because it's just not for COVID alone. After the COVID, the world needs to change, and it has to go, and the country themselves has to survive. So we have to think beyond beyond day to day of containment that has already been said of what worked, but it has to go for what the country future would look like. What is it at this time you can capitalize on? And I can't say enough about putting health system and food system together for once. You will see a very surprise delight in that thing. Over.
Thank you, Iman. Yes, be creative and give chance to new ideas. Very, very important. Dr. Gendevon.
Yes, I think it's a difficult question, as our previous speaker mentioned that. But the experience in Laos that although we have the neighboring have the very, very high incidence and of the outbreak, but because of we take the measure on the lockdown that we so far we can control, and then there is no increasing and of the cases, and already 3 months, nearly 3 months we have no cases. So that I think that of course they have some negative and positive, but once we don't have the good healthcare system, that lockdown is one of the important measure. And in addition to that, we cannot lock down and we can close for a long time, right? So on the one hand, we need to strengthening of the healthcare services and system. That's why I emphasize. And on the one hand, but on the other hand, we also should strengthen about the economy, because if without the growing of economy, that's affect also to the a disruption of the healthcare services, because we need of resources. So that I think both we should do parallelly. Yeah, thank you.
Thank you, Dr. Chandavan. Axton, any thoughts?
Yeah, just a very quick comment on this. First of all, I think the understanding of how COVID should be understood, I think it's very different from the urban and the rural areas as well. So I mean, in all of the news, in all of trying to understand the concepts, like social distancing and all the likes, the urban area seems to have a better grips on how to think of it. But when you look at the rural areas and the people in the outskirts of the cities, they seem to have, they don't seem to understand that correctly, because one, the language that they use is very technical, and secondly, like what's in it for them? Like, if they don't leave the house, they won't be able to go to work, and if you don't go to work, it's on a daily basis kind of concept. So I think that's one part to look at it. I mean, I agree with Professor Amon on the concept of, there's a lot of innovations coming along, but the innovations right now is a lot of digital work, right? And if you look at Indonesia as a whole, like there's some parts that is 5G, like in Jakarta with the metropolitan, which some of my co-workers will work just fine with just digital. But at the same time, there's a lot of areas outside of Jakarta that is still 3G, some even 2G. So those are the areas that would be most affected. I mean, in terms of education, in terms of how we look at formal and informal workers as well. Like, informal workers is more on the physical and selling it physical as well, like the stores, the restaurants and all that. So it's a very touchy subject. I don't know whether I touched on the thing, but it's a very fine line. And I think the government per area basis has a very big job in front of them to consider which one to go for.
Yeah, thank you, Esther. I also think what you mentioned is very clear. Also, the difference between urban and rural, it's everywhere. It's like it's also very clear in the rest of the world. Like, you have the infection rate is much higher urban than rural, but it also, despite the fact that they know better how to respond to it, which is really interesting. I know that we are 2 minutes past 8. I would like to request the organizers of this meeting that we could come back in a couple of months, because I think I think the discussions we have are really, really important and very interesting, and it's so short, 1 hour. It's very clear that we can continue to discuss this for a couple of hours, but we don't have the time. So I would like to thank you all I have learned a lot this morning, but I think it's the beginning. And I think, what we have learned from COVID-19 is that COVID-19 is, of course, something which we have to learn all the time. Like, there are 30,000 scientific papers out in the first couple of months. And every week we're learning more. And I think we need to adjust to that. And I think, so to be agile is extremely important for all of us. And I like really the spirit of all the speakers saying that, yes, it is a disaster. We have huge problems, but if we don't stand up and if we are not creative, we will go down the drain, and we don't want to go. We are human beings, and we have to work together, and there is hope, in the future. And I think it's important that we keep that, because we have responsibility to, billions of people in the world. So thank you very much again, and I give the floor back to the organizers.
Before Suneva wraps up, I'll just echo your sentiment of kind of reconvening on this issue. This is not going away anywhere anytime soon. So I think keeping the dialogue open and really seeing maybe, how things have been progressing is an excellent idea, and we'll certainly reach back out to all of you. Suneva.
Yeah, thank you so much to the panelists and the moderator for such a fruitful discussion. And we'd like to also invite you to please join us again next week on Wednesday at the same time for a fourth session that will address the impact of COVID-19 on other communicable diseases programs such as HIV, AIDS, TB, and malaria. Thank you again.
Okay, bye.
Thank you, everyone.
Thank you so
very
much.
Thank you
Bye.
very much for the opportunity. Thank you.
Bye.
Likewise,
Bye.
thank you. Thank you for the
Bye.
opportunity.